and thank you for tuning in. I'm glad you're here. Today I'm going to talk about HRT, hormone replacement therapy. Specifically, HRT for those of us assigned male at birth transitioning to female. The most widely accepted standard of care for transgender people the world over comes from WPATH. WPATH is the World Professional Association for Transgender Health. It's an international, multidisciplinary professional association whose mission is to promote evidence-based care, education, research, advocacy, public policy, and respect in transgender health. So keep in mind, when it comes to hormone replacement therapy and life in general, your mileage may vary, meaning everyone's not going to have the same result. So today I'm going to talk about the different effects of HRT and specifically how they've affected me. And again, you may not have the same outcome that I'm having. So the first thing that they mention when you start HRT is body fat redistribution. And you start seeing changes between the first 3 and 6 months. And you can expect your maximum effect in 2 to 5 years. First thing that I noticed was the fat around my eyelids kind of disappeared. I used to have really heavy hooded eyes, and I still do have hooded eyes, but not as prominently hooded as they were before I started HRT. So that's when my eyes started opening up a bit, because that fat that was weighing my upper eyelids down started to move someplace else. So the second thing that they mention is decreased muscle mass and strength. Also, the onset for that, again, these are just guidelines. 3 to 6 months, maximum effect in 1 to 2 years. So it took a long time for me to notice that I was not as strong as I used to be. I would say in my case, it was a solid 4 years, maybe 4.5 before I noticed, oh, I'm not as strong as I once was. The first time that I had trouble opening a jar was only about 1.5 years ago, and it blew my mind and made me really happy because it was validating. So now I have to use all kinds of tricks to open a new jar. It's okay. Moving on, softening of skin or decreased oiliness. I never really had oily skin, but the softening, that was one of the absolute first things that I noticed. My skin seemed so much softer, even just a month in. And I remember about the 6-month mark, I was having lunch with a friend of mine, and he looked at me and he said, "You look 15 years younger. What's happening?" And I wasn't out yet. I've only been out socially since January of this year, and this was 5.5 years ago. He said, "Yeah, you look great. You look 15 years younger." And I put it down to, well, maybe I'd lost a few pounds, which I was dieting, but it was totally my skin. And then a few weeks after that, I ran into another friend at the grocery store, and the first thing that she commented on was my skin. It was something along the lines of, "Oh my God, your skin looks amazing." So that was pretty quick for me. The next effect that you can expect on HRT is decreased libido. Onset 1 to 3 months, maximum effect 1 to 2 years. I would say that was about right for me as well. Decreased spontaneous erections. Yes, we have to talk about erections. So, this was a great source of dysphoria for me. Not all trans women want to have bottom surgery. Not all transgender women even want to have hormone replacement therapy. Some people just socially transition, and that's all they need to feel like themselves. In my case, I want the whole shebang. I want the surgical intervention. The hormone replacement therapy has done wonders for me. So, moving back to the spontaneous erections. This was a cause of great dysphoria for me because my brain doesn't want that body part. Ironically enough, so I started medically transitioning in my late 50s, started taking hormone replacement therapy. And around that time, and really for the next 4 years, it took 4 years for them to get my levels right. And for them to like completely nuke the testosterone in my body so the spontaneous erections stopped. I feel like I've said erection more time in this video than I have in the last 30 years. Okay. So the ironic part is I had male friends who were in my age range, give or take 5 years, let's say, who had confided in me that they were taking testosterone supplements and it was doing them a world of good because they had a checkup and they had low T levels. So unfortunately for me, I had higher T levels and it took a long time to get those under control. Male sexual dysfunction. The chart says it's variable. Breast growth. Okay. So I am a small-chested woman. I've been on hormone replacement therapy for 6 years now. I've been on the proper dose for about 4 years. According to this chart, the expected onset is 3 to 6 months, and your maximum effect is going to be about the 3-year mark. Anecdotally, from other transgender women, I have heard as much as 4, 5, or even 6 years before your breasts are completely done. But most of the magic happens in the first couple of years. Next up on the list is decreased testicular volume. Never measured. I can't tell you what my experience was on that. Wasn't keeping track of it. But they say 3 to 6 months for it to start, 2 to 3 years for it to be over. Then there's decreased sperm production that is also variable. Then there's thinning and slowed growth of body and facial hair. Onset 6 to 12 months, and the maximum effect is greater than 3 years. Okay, so on this, my body hair disappeared pretty quickly. I was never super hairy. I never had hairy legs. I had chest hair, but not a lot of it. I had hair on my arms. Again, not a lot. I could grow a full beard though. So I would say in my case, I didn't have to wait 6 months for the body hair to start disappearing. That happened within the first month and a half maybe. Now it's gone. I don't have to shave my torso at all. I get my legs waxed about every 2 months. That seems to be sufficient for me. The facial hair. So I haven't grown out my facial hair in a very, very, very long time. So I can't really speak to that. And I do have to shave every day. I do still have a beard. So I missed the window to start laser treatment. My beard had already turned white before laser was an accepted, readily available method for removing body hair. And right now, at the filming of this video, the current technology requires that you have fair skin and dark hair. And I've got the fair skin, that's obvious, but my hair is no longer dark. So, until the laser technology improves, I'm left with either shaving every day, sometimes twice a day if it's a long day and I'm going out later at night, or electrolysis. So electrolysis is going to take me several years if I start that, and the downside to that is I have to stop shaving for several days in between appointments. And having a beard is an enormous sense of dysphoria for me, as well as the wrong body parts. So I've chosen myself to deal with this by shaving every day and then covering it up with makeup. And the last thing that they talk about on the chart in what you can expect when you start HRT is male pattern baldness. So it should stop within the first 1 to 3 months. And then they say after 1 to 2 years, you don't have to worry about it anymore. So they don't talk about regrowth. I have had some slight regrowth just from estradiol, but most of the regrowth that I've experienced has been from minoxidil. So that's a separate conversation that you need to have with the dermatologist, at least here in the US. One last note on HRT. Your healthcare professionals are an extremely important partner in your transformation. I get my healthcare through the Veterans Administration because I was in the Navy. When I first started, I had a misogynistic, transphobic endocrinologist who refused to follow WPATH. She had me on the lowest possible dose of estradiol. She refused to put me on any of the testosterone blockers. She refused anything that I wanted for my own health care. She flat out refused to allow me to be a partner in my own outcomes. So I was stuck on the absolute lowest dose for the first 6 months, and then after that, that was 1 milligram. That was 1 milligram a day of estrogen or estradiol. So after 6 months of being on the absolute lowest dose, she increased it to 2 milligrams a day, which is still far lower than what WPATH recommends. And again, nothing else. No testosterone blockers, nothing. So I fought with this woman for 2 years trying to get her to come around to my side, and at about the 2-year mark, she admitted to me that she was not even following WPATH and that she refused to because she had her own methods. So I fired her. I went outside the Veterans Administration for healthcare because she was the only endocrinologist there. So I had to go outside the VA to start getting my hormones, and that actually helped me quite a bit. That's when I started having breast growth. I did not have it in the first few months like the guidelines suggested I may. It was 2 years before I had any significant breast growth at all. So in some respects, I have been on the proper dose of HRT for not quite 4 years now. So my advice to you, if you're starting this journey and you have a bad endocrinologist or a bad anything in your healthcare team, fire those people. Fire those people and get you someone who's an advocate for you and is going to follow WPATH, because it is the accepted method for transgender people care worldwide. If you have any questions about HRT, please leave them in the comments below and I will answer anything that I feel qualified to answer. Also, I've got plenty of links in the description box below. And if you'd like, please subscribe. I would love it if you would subscribe and then hit the little bell asking to be notified when I release a new video. My goal is to have a new video every Monday at minimum on this channel. Stay safe. I hope you have a lovely week. Thank you so much for tuning in, and we'll see you next time. Bye.